Hey guys, welcome back to the channel. If you're new here, my name is Lucas. I'm a first year ophthalmology resident at a university eye clinic in Germany, and today's video is another life as an ophthalmologist video where I talk about my experiences at work during the last 2 months, basically since the beginning of 2022. So let's get started. Before I actually can talk about my experiences in ophthalmology, I have to tell the truth that I actually left the department for a couple of weeks. The reason for that was there were a rising number of corona cases in Germany, so they needed more and more doctors helping out in the pneumology department. They asked our department if some doctor could come and help out, so I volunteered and said, yeah, I offer my help to move over there. So basically I spent there a couple of weeks in the pneumology department working with a new team in a new specialty for me, and it was a whole new experience. We had a ward with around 15 patients who were all corona positive, and they came from all kind of other departments. So every corona positive patients had to be moved to this department, and therefore we had patients with internal medical diseases like cardiac diseases, kidney diseases. We had patients with surgical problems like broken bones or whatever. We had some patients with tumors, like facial tumors. We also had patients from gynecology department, like there was a woman with a newborn baby, just like 1 or 2 days old, had to stay with us for a few days. So that was really different to my daily work in the eye clinic, and it was challenging, but a really inspiring and cool experience. My daily work was basically to do hospital rounds. I saw the patients very early in the morning, and we talked about symptoms they had, problems they had, and I took histories. I did physical examinations, mostly focusing on the lungs, of course, and the heart. Most of the patients had a lung problem, needed some oxygen support. Besides that, I had to take blood of the patients. We also ordered PCR tests for corona every couple of days, prescribe medications, order CT scans, X-rays, MRIs, and also consult doctors from the other departments to take care of the initial problems why the patients came to the hospital. So it was really busy days and challenging, but a lot of fun. And I also made new friends there, so I'm really happy for that time. However, at the end, I was so glad to go back to ophthalmology department, and I knew that I made the right decision and not go for internal medicine or surgery after this experience, and that was really good to see that that I actually made the right decision with my specialty. Since I left the pneumology department and came back to the eye clinic, I've been in the outpatient clinic. So that is the place where patients with eye diseases come and get a regular checkup for the disease every few days, weeks, months, or sometimes even years, depending on their disease. And of course, we also see sometimes patients for the first time who get like a diagnosis for a new disease, and then they get a treatment, and sometimes then they also have to stay in the hospital, but that's usually not the case. So a typical day there starts around 7:30 in the morning and ends around 4 p.m. officially. However, mostly I stay longer because I am still not the fastest in everything I do, and also because sometimes it's just not possible to manage everything until then. I have to write medical reports. I have to solve tasks that came up during the day. Sometimes I also watch surgeries in the OR, or I practice doing surgeries on my own in the clinic. So typical day, yeah, every day is different. So every day we focus on different kind of eye disease. Some days are about retinal diseases, some are about glaucoma, other ones are about tumors, age-related macular degeneration, cataract, corneal diseases, or eyelid problems. So besides that, sometimes I also have to stay longer in the clinic until 7 p.m. So from 4 to 7, you're basically the only doctor left all alone in the clinic, and usually you have to treat patients, emergency patients. So that are patients with problems like retinal detachment or chemical burn, corneal perforation, central retinal artery occlusion, or patients with anterior ischemic optic neuropathy. So there's a wide range of different kind of problems that I've already seen in the clinic, and then I usually have to talk with my attending about the procedure and the treatment plan. To focus a bit more on the day-to-day work, retinal diseases, you learn a lot about the treatment options like scleral buckling or vitrectomy or a combination of that. Treatment options like pneumatic retinopexy, laser retinopexy, cryoretinopexy, silicone oil injections. So it's very interesting to learn about the different options and when to use them. Yeah, really able to learn a lot about treatment options there. For glaucoma, I do gonioscopy to get better in seeing how the open angle and closed angle glaucoma, to differentiate this. I learn a lot about the different medications that exist to decrease the intraocular pressure, surgical procedures like stent implantation, trabeculectomy, and laser procedures. So it's very interesting about that field too. About tumors, yeah, on my first day I saw like basically 3 new diagnosed choroidal melanomas. That was really sad also to see patients with this kind of disease. A friend of mine told me that a private practitioner eye doctor usually sees around like 2 patients with that kind of disease in their entire career. So on my first day I saw 3. That showed me why I came to the university hospital to practice there, to see a lot of cases and to learn about everything. About cataract, you find out about the different kind of stages of the disease and the treatment options. Corneal disease is also very interesting. I've seen a lot of patients with hepatic keratitis in the last weeks, so it's very interesting and not that easy to diagnose for me always. So besides that, I also have some duties regarding teaching. So the last couple of months I've done some teaching classes for 5th year medical students. I gave a class to them. Sadly, that was not in front of the students but online. I really enjoy talking to the students, interacting with them much more than doing this. However, because of Corona, it was not possible at this moment. Besides that, I also had a practical course for 3rd year and 4th year students where they practice to use the slit lamp to do an anterior examination of the eye, and also to practice to do a fundoscopy for the posterior examination of the eye. That was a lot of fun to interact with the students. I really enjoy teaching them stuff, and actually the students are really quite clever and they're really able to learn fast. And I think they also enjoyed a lot to get some practical experiences last month, because most of their classes were really cancelled due to Corona. Yeah, that were some of my experiences in the eye clinic in the last couple of weeks in the early 2022. I hope you liked it. I hope you could get some insight how it's like. And I'm looking forward to making the next video for my life as an ophthalmologist. Next time I will talk about my experiences during my first night shifts in the clinic, which were quite busy for me, and always difficult choice to think about calling the attending in the late evening night or not. So yeah, hope you guys are looking forward for this video too, and see you soon.